everybody. This is Eileen, and this is webinar 16 for the post-active treatment surveillance in prostate cancer and NCDB special study. So we will give people a couple more minutes to join, and then we'll get started. Okay, so I think we can get started. So the study progress as of today, we have around 6,800 patients are submitted as eligible, and almost 700 sites are complete with the study, and 324 are still working, and 109 have still not started. So if all cases are submitted, the site has completed the study, confirmation emails will not be sent out. So if all of your patients show at the bottom screen under submitted patients, then you are complete with the study. The deadline is Monday, August 28th at 11:59 p.m. Central Time. So the purpose of the study is for patients who have received curative intent prostate cancer treatment to determine whether more frequent PSA testing leads to better survival or more harm for the patient. In order to answer this question, it's important to know every PSA test that the patient had. You need to know exactly how frequently a patient is having PSA tests and to know if the patient has had a recurrence. So we hope that many of you have already contacted the outside facilities on your patients. If there's been no response or no information returned from outside facilities after waiting 2 weeks, and you've tried calling, faxing, and sending the template letters, then please mark the patient ineligible. And if the replacement patients are from the same practice, then you can automatically mark them ineligible in order to save time. If cases still show in the patient data to be submitted section after the deadline of August 28th, your facility will not receive credit for standard 5.7, and you will receive a non-compliant rating. Sites that only submit ineligible patients can still receive credit for 5.7 for doing the work of determining eligibility, but you have to make sure that there are no patients left to be worked on and they're all submitted by the deadline. So we have determined that Monday, August 21st will be the last day to replace a patient. And this is because we want to make sure that you have enough time to enter all the data on the patients that you have already determined if they're eligible. And August 21st is 1 week before the study deadline of August 28th, 2017. And if you accidentally mark the patient as eligible and they are ineligible, then you can email us and we can reset the eligibility question. So you'll be able to change the question to no as long as you give us the reason why they are ineligible. So today's webinar will be the last webinar for the 2017 prostate special study. We have noticed that people aren't really asking as many questions, and a lot of sites have already completed the study. So this will be the last webinar, but you can feel free to continue to send questions by email at specialstudy@fax.org. And we will continue to answer your emails up until the deadline. So we want to reiterate that for the NCDB tab on the question for receipt of radiation, you can use the following chart to code for this field. This has also been included in instructions version 2, which can be found on the website. So we're hoping that everyone's using instruction version 2, and this is the code that you would use for receipt of radiation. So we've gotten a couple questions about PSA still. So if the PCP and the urologist have duplicate PSA records, they do not need to be entered twice. If you know this is the same PSAs from the same day and they're just in both medical records, you don't have to enter them twice. Registrar should follow the Ford's manual. So for example, a PSA of 1.2, the registrar can enter 0, 1, 2, or 12. Numerically, these are identical numbers and will not affect the study or data analysis. So for example, a PSA of 0.02 would round to 000 or 0 as the answer. So you would just move the decimal over one place and then round to the nearest whole number. This is true for all the PSAs except for when a patient has the result of less than some number. So it could be less than 0.03, less than 0.01, less than 0.2, less than any number. Please enter the result as 0 for the special study only. In this whole instance, we differ from the Ford's manual, and the example was given in the instructions to show this, and that is in version 1 and 2 of the instructions. So when the doctor indicates possible recurrence and a treatment starts, this should be considered recurrence. The date of the recurrence should be the date of the doctor's note. The term salvage radiotherapy indicates the recurrence. And if you're wondering if this is a biochemical recurrence, is it a local, regional, or distant recurrence? Usually biochemical recurrences do not meet the definitions of the local recurrence, so only enter local, regional, or distant recurrence if it meets the definitions in the instructions document. So after definitive radiation treatment, if cancer is shown in the TOR pathology, please record as a local recurrence. So once a case is is submitted as ineligible, it will automatically be replaced and will not appear on the patient list. The web form will not allow submission of incomplete information. So we trust that the registrars submit patients without errors. We will not, once they're submitted, we will not be reviewing them and sending them back to you before the study deadline. If changes need to be made to a submitted patient, or if you accidentally mark the patient ineligible and he is eligible, then email specialstudy@fax.org and include the special study ID and the FINs in communication and an explanation of why you would need to reset the patient. So this is webinar 16, and we are offering NCRA National Program Recognition information. So the last 5 webinars have been 0.5 credits, and all the ones before that have been 1 credit, since we cut them down from 1 hour to 30 minutes. And the numbers are for the NCRA are 2017-093 for today. So we've gotten questions, should we enter the biopsies that diagnose the prostate cancer? Usually these biopsies occur before the surveillance start date, so we only want you to enter the biopsies that occurred after the surveillance start date, which is after treatment. The initial biopsy that diagnosed the prostate cancer is not in the surveillance period. So the first line cannot be deleted since there cannot be blank answers. So on the biopsy tab, you need to, if there were no biopsies, then you would need to add a new test and enter the 0 option with 8 zeros. The first line on the add new test will not be able to be deleted since something needs to be entered even if there are no biopsies done. And this is also the same for the testosterone tab and PSA and the scan tab as well. So for standard 5.7, are sites automatically compliant with the standard for submitting cases to the study? Yes, the sites that submit all of their patients by the study deadline are compliant with standard 5.7 in 2017. Sites that have less than 12 patients on their list will still receive credit for standard 5.7. Sites are required to submit all of their eligible patients, up to 12 total. So if, for example, if you had submitted 12 patients as ineligible and there's still patients on your list that could be eligible, you are required to submit all of them until you have 12 total. If the patient had active surveillance as a first course treatment and radiation as the second course treatment, are they still eligible? Yes, the patient can still be eligible. You would use the end date of the radiation as the surveillance start date. And if a patient had active surveillance followed by a prostatectomy, you would use the date of the prostatectomy as the surveillance start date. So for the confidence questions, how would you decide the confidence interval rate? The confidence questions are based on the registrar's sense of completeness of the data that is entered. So the questions are at the bottom of the PSA and the scan tab. So now we can go back to this slide, and we will answer the questions that are on today's webinar. So there's a question, if you have called the patient eligible, but it turns out there are not adequate records, can you have the patient thrown out of the study? And how would you go about doing this? We ask that you would email specialstudy@fax.org with the special study ID and your FIN, and also an explanation of why they are ineligible. So, for example, in this situation, it would be that you are unable to get all of the records and you accidentally marked them as eligible. So on the testosterone, if the results are less than 20, what would you record for the results? That would be 0, since there is a less than in front of it. If you're having any technical problems on the recurrence tab, if you could just send us an email with the special study ID, then we can help you enter all the data there, so you won't have to come back the next day. So that is correct. So if a facility's patients were not eligible, the area and data links for the study would show no patients as submitted because there were no patients submitted as eligible, but we still have the documentation that you submitted patients, but they were all ineligible. So if the PSA is 0.08, you would round it to 0.001. So 0.08 rounds to 0.1, and then you would enter 0.001. So if a post-prostatectomy patient has cytoscopy TUR for bladder neck stricture with benign findings, does this need to be included in the biopsy section? No. If a PSA is less than 0.008, is that considered zero? Yes. So if there's less than any number, please consider that zero. So at this point, we have reached all the questions that were asked today, and we will stay on the line for 10 more minutes. So if you have additional questions, you can type them in the question section on the GoToWebinar. So we got a question about, will you be notified of the results of the study? Yes, we hope so. The results kind of take a while to analyze and publish, but once they are, you should be receiving the results. It might take a couple of years. So there's a question, after 8/21, you will not be giving us any more patients once we deem the ones on our list ineligible after review and phone calls. Technically, the 8/21 deadline is for if you need to mark a patient as ineligible, and then there's a replacement patient that comes on your list. That will not happen after 8/21. So if you've already marked your patients as ineligible and there's no new ones now, there will not be any new ones added after 8/21 either. So if you need to mark a patient ineligible, it should happen automatically, even right now, and nothing will change up until 8/21. But once 8/21 happens, there just will not be any replacements, and you will have to work with the ones that are currently on your list. So there is some other eligibility criteria that is done behind the scenes. So even if you think that you have patients at your site that are eligible, they might not be due to other reasons, and that's why they're not showing up in your patient list. So only the ones that are showing up on the web form would be the ones that you would need to complete. So if you submitted the PSAs the wrong way, you can email us up until the deadline and we can have you edit them. We do ask that if you entered them wrong, that you ask us to release them back and you can change them. Okay, so I think that's all the time we have for today. This was our last webinar, so we want to say thank you to everybody who has been working on this study. And we know it hasn't been easy collecting all the records, and we really appreciate everything you've done. And if you think of more questions, you can feel free to email us at specialstudy@fax.org. And we hope to give you the results once we get them, which might take a couple of years, but we will definitely share them with you. Thank you.